Sorry kids, the camera stopped working, so we're just gonna continue on with part 2 and finish this video.
Usually be pulled back to expose the glands of the penis by puberty. According to the American Academy of Pediatrics, the potential health benefits of circumcision include easier cleaning of the penis, decreased risk of getting HIV, sexually transmitted infections, urinary tract infections, and certain cancers, and prevention of foreskin problems, such as complications from the inability to pull it back over the tip of the penis. Other common reasons for circumcision are religious, social, and cultural beliefs. Before the procedure, the area will be cleaned. The caregiver will apply pain medicine either as an injection or as a numbing cream. During the procedure, a small slit will be made in the foreskin, and it will be loosened from the head. The caregiver will place a device over the glands. This device will protect the penis, allowing the foreskin to be safely removed. If a plastic device is used, the caregiver will tie the foreskin to the ring. Then the foreskin will be trimmed. The ring will be left in place and will fall off in 5 to 7 days, leaving a healed circumcision. If a metal bell device is used, the foreskin will be trimmed around the base of the bell. The bell will be removed at the end of the procedure. After the procedure, it is normal for the glands to be sensitive, appear raw, and have a little yellowish discharge. If a bandage is used, change it with the diaper. Use petroleum jelly or antibiotic ointment to keep the bandage from sticking to the wound. It's safe to wash the penis gently with water as it heals. The circumcision should completely heal within 10 to 14 days.
Okay, so now that we have watched a diagram of a circumcision, we will move on. Okay, lanugo. We talked about this already. Lanugo is the soft, downy hair that may cover the face and body. I did pick a picture of a baby who had more of it, so it was more visible. Sometimes babies have very little, some have a lot, some have a medium amount. It just depends on the baby. Vernix is the waxy covering that helps protect the baby's skin while in the womb. This is usually washed off within the first couple of hours of birth with the baby's first bath. And then milia. Milia is plugged oil glands over the baby's forehead, nose, and cheeks. It's little whiteheads, and it looks just a little bit like acne. It looks like acne, and so I always call it baby acne, but the proper word is milia. This is my niece Emma when she was a newborn, and she had it she had it pretty bad, but it went away after a few weeks. You can even see on her forehead, she's got a little bit of her lanugo still left, but like I said, it all goes away. And then it just kind of, you don't ever want to pop them like you would your normal zits because that would hurt them. Just leave them alone and they will go away. Okay, hearing and sight. Hearing develops in the womb and the fetus responds to sound after birth. The baby will turn its head to familiar voices, especially mom's and dad's voices, because they heard them the most while they were in the fetus. So they will recognize your voices when they're born. A newborn can only see about 8 to 12 inches in front of their face. So I wanted to show you how a baby's sight develops throughout its first year of life. When they're a newborn, they can see hardly anything. Very, very fuzzy. They can maybe see your hand if it's directly in front of their face. 4 months, they can start to see a little bit. They can start to see their surroundings a little bit. Maybe if you're pretty close to them, they can see you, but they can't see anything else further away. 7 months, they can start to see figures pretty well, and they can see a good distance, but they can't really see a lot of surrounding items. And then at about 1 year, they have their good vision, and they can see everything around them. Newborns can taste and smell at birth, so they are accustomed to that as soon as they're born. And then smell is their best developed sense. A baby, when a newborn enters the world, they have little physical control. They can hold their heads up on their own once if their neck and head is supported, and you must support the head and neck. It's very, very, very important. They cannot lift their heads unless their neck is supported. And then them lifting their heads comes with time. As they strengthen their neck muscles, they can start to hold their head up. Remember, their head is 1/4 the size of their body, so it's very hard for them to figure out how to hold that up. It takes a lot of muscle strength. A newborn baby will probably spend a lot of time sleeping or eating. They usually sleep for about 20 hours per day when they're first born. And then the other 4 hours, they're usually eating throughout the day. They don't do much. Crying is a response to an unpleasant stimulation. A baby needs to be calmed and held when they're crying. Okay, so this is something that they give a baby when it's very first born, like within the first 5 minutes of birth. It's called the Apgar Test. Okay, and they test 5 different indicators on a baby. They test their skin color, which is their appearance. They test their pulse, their reflex irritability, and I'll go through baby reflexes in a minute. Their muscle tone, and their breathing and their respiration. Okay, so obviously, if your baby is scoring 0 points, your baby's most likely not alive, so that's rare. Okay, but 1 point is where they can they have a pretty pink body, but they are like their fingers and toes are blue. Their pulse is either, if they get a 1 point, it's below 100 beats per minute. They don't respond very well to their reflexes. Their arms and legs are flexed and they don't move very much. And then their breathing is slow and irregular. Okay, and then obviously what you want your baby to receive is you want them to get 10. You want them to get 2 points in everything, which means they get a perfect 10. And that means they're pink. Their beats are over 100 beats per minute. They respond to their reflexes. Their muscles are very active, and they have a vigorous cry. Okay, as soon as your baby's born, they'll start testing this. And my sister, actually, when she was having her baby, she had no idea what this was, and she asked me about it later. Well, actually, I was telling her about her Apgar test because I went in after Russell was born, and I said, "So what was his Apgar score?" Just kind of teasing her. And she's like, "What are you talking about?" And I was like, "They test their appearance, their pulse, their reflexes, their activity, and their respiration. And they give him a point, either 0 out of 2. And she goes, "Is that what that was?" She goes, "As soon as he was born, they took him away. And I could hear the nurses say, that's a 1, that's a 2, that's a 2, that's a 2, that's a 1. And she was like, and I didn't know what it was. And I was like, yeah, they were giving the Apgar test. And so that's what's done after the birth. And they do it 1 minute after birth. They do it after the first minute it's born, okay? And then again 5 minutes after delivery, because sometimes you can look, a baby may have blue fingers and toes, and when they're very first born, just because of how the birthing experience went, but after 5 minutes they may start to turn pink. So they do that 1 minute and then 5 minutes after they're born so they can see any changes. So your baby may get maybe a 7 out of 10 the first minute, but then a 10 out of 10 on the 5th minute. So that's why they do that test twice. It tests for the newborn's ability to adapt and to thrive in life outside of the uterus. The medical team observes the neonate's heart rate, breathing, muscle tone, and response to stimulation and skin color. Okay, fontanelles. These are the space between the bones of the skull in an infant or a fetus where ossification is not complete and the sutures are not fully formed. Basically, it's a soft spot. You can see the area that is unfused in between the skull. That's their soft spot. They have 2. And it's to help the head go through the birth canal a little bit easier. And then also the child's brain grows after it's born. It triples in size in the first 2 years of life. And so due to this growth, the fontanelles allow expansion. So your baby will have a soft spot for the first 2 years of life because his brain is growing. Let's talk about newborn reflexes. Reflexes are basically your survival skills, and it's what newborns can do and a way for a physician to check the functioning of the baby's neurological system. And so you have a certain different type. You have different types of reflexes, and I'm going to go through those with you. First, you have your rooting reflex, and this is when the baby's cheek is stroked. The baby will turn towards the side of his or her face that was stroked. It's a response to them wanting to eat. What they're doing is they're turning their cheek to a breast or a bottle to find food. Okay, then you have your Moro Reflex, or also your Startle Reflex. This one's my favorite because I think the baby looks so funny. But basically, it's where there's a loud noise or sudden movement, and the baby freaks out, and it kind of scares them, and so they kind of jump a little bit, and their arms fling out, and their feet fling out. It says their arms and legs. Your arms have clenched fists, but they don't always have clenched fists. But if you've ever actually scared a baby, you've seen them do this, and it's really sad because they usually cry afterwards because it scared them. But also the face they pull and their little jump they do is pretty funny. So that's your Moro Reflex. And then you have your Babinski Reflex, and this is when the sole of the foot is stroked from heel to front and the toes fan out. So that's your Babinski Reflex. And then you have your grasping or your palmar reflex. And this is when an item is placed in the palm of the hand, the baby's fingers will grab around it. They close around the item. When the little baby holds your finger, that's their palmar reflex. Okay, so now I'm going to explain to you the assignment that you're going to be working on this week, and it's called the cost of having a baby. So what you're going to do is you are going to, if you go into the Unit 4 module, you will find the cost of having a baby, okay? And sorry, I'm trying to find it. And it is right here, okay? So that's your cost of having a baby. And what it is you are going to look up all these items, and you are going to price out the item and then the total cost, okay? You are going to price out your pregnancy needs, your delivery needs, and your baby's clothing, okay? And then sleeping needs, diapering needs, feeding needs, baby care supplies, and additional items. Don't worry, I'm going to be giving you a lot of time to do this, so do not stress. It shouldn't take you more than an hour or an hour and a half to do. It does not have to be done in one sitting. Don't stress about that. And so the easiest way to do this, honestly, is I would go to Amazon and use Amazon for all of my items, okay? That's what I would do. But you can do Amazon, you can do Target.com, you can do Walmart.com, anything like that. But I just do Amazon because it's easiest. So I would go to Amazon and I would look for a maternity wardrobe, so a complete outfit. So I'm going to go to Amazon and I'm going to type in maternity outfit for women. Okay, well, obviously it's for women, but okay. I'm going to search. Okay, and they're going to give me lots of options. Like this dress right here is $21.99. These pants are $26.99. Maternity maternity bra is not a different section, okay? Another dress, a nightgown, some pajamas, different things like that, okay? So here's a robe set, here's a dress, here's a top, that kind of stuff. So you're going to figure that out. So I'm just going to go with the dress just for right now, just so you can see. So that's $21.99. So I'm going to go back to my account and I'm going to say it was $21.99. And I'll just go ahead and say we'll say that all my outfits are that price, but you can just go and look. And so $21.95 times 5, because you'll want at least 5 outfits. You'll probably honestly have more than that, but we're just going to do times 5. So $21.99 times 5 is going to be $109.95. Okay. Then I'm going to go and look up maternity underwear on Amazon. Maternity underwear. Okay. And that's going to find, you can do low rise. It depends on what kind of comfort you want, or you can do high rise, or like connects the baby. So this is a, let's see, this looks like a set. Okay. So this is a, you can look at all these different kinds of things. I think this is a set of 5. And so it's a set of 5 pairs of underwear. And so we're going to go and look back at the thing. And it says you need 5. So my total price for that is $25.99. So I'm going to do $25.99. But that was for 5. So my total is $25.99. $25.99. I got it on Amazon. Okay, maternity bra. Let's go and look. Yeah, I would stick on Amazon. It's honestly the easiest. So let's look Maternity Bra. So this one looks like it's a set of 4. Okay, so that's solid. And it is going to be $26.99. So we'll go back. I'm going to type in $26.99. And it says I only need 3, but the pack of 4 is probably cheaper than buying 3 separately. So I'm just going to say the pack of 4. $26.99. And it was, I'm going to write 4-pack just so I know. And I'm going to write 5-pack here so I know that you guys got the packs instead of just one, because I don't want one pair of underwear to be $25.99. And so then $26.99 is my total. Then let's look at Maternity Shoes. Okay, and I'm going to click on these ones. Look like they're nice and comfortable, and they're $30, and they're on sale, and they're Skechers. Skechers are usually pretty good, or Dr. Scholl's. I'm going to go with a $30 pair. So that one is $30. Let's go back. That one was $30. Got that on Amazon. And that would have been $30. And then it says Prenatal Vitamins, about 150 tablets. It says you can go to mothernature.com, but once again, I'm just sticking on Amazon. So let's do Prenatal Vitamins. Let's search those. Okay, and here is some prenatal. Let's look. I don't know why my... Are these? This is a dietary supplement. Let's do... Oh, I spelled vitamins wrong. That's probably why it did not give me a lot of options here. Oh, nope, I'm back. Oh, it's because I'm in clothing, shoes, and jewelry. That's why. Okay. Let's move that to... Okay, I'm in baby now. Okay, hold on. I'm in Amazon fashion. That's the problem. Sorry, 1 second. Let me figure this out. All departments. I don't know how that happened. There we go. Thank you. Okay, so here's some prenatal vitamins. And this one looks like it has 90 soft gels. So I would, and that's $36.98. And so I would need 2 of those. Or I can keep looking for the number I need. You need about 150. So this one's 250 right here. So that's $20.48. For 250 tablets. So we're going to go to, that was $20.48. And you need 2 of those. So $20.48 times 2 is $40.96. And I got those. I didn't get those from Mother Nature. I got them from Amazon. Okay. And then other, we're not going to go other, and then it says next after that, oh, and then you're going to do your total cost, okay? So I'm going to add that up. This makes it way easier when you get to the end if you have your total costs, instead of having to add up 30 plus items or more. If you do your subtotals, you could add all your subtotals up at the end. So $109.95 plus $25.99 plus $26.99 plus $30 plus $40.96. So that my subtotal is $233.89. Okay. So then as I'm going through all of these, I want to do my subtotal, because if you look, when you get to the very end, you have to put all your subtotals right here anyways. So if you've already done that calculation, it makes it way easier. So you just come and take that number. So that one was $233.89. Wait. $233.89. So I'm going to come down here. $233.89. And then when I get to the, when I do all of my sections, I'm going to do my total cost. I'm going to give you a hint right now. Your total cost is going to be around $7,000. So if you've gone more than that, you're in trouble. So the next one is your delivery needs. Okay, and so what I want you guys to look up is basically, you don't need to use this link if you don't want to. I'm going to take those links away, and I'm going to look up, I'm just going to look up how much a hospital delivery costs with no complications, okay? So how much does a hospital hospital delivery cost with no complications. And it costs about $2,600. And so I'm going to go through because I can see that right there. Okay. $2,600. Now, if you have insurance, that's going to vary, but we're not going to go into that because everyone has different insurance. So we're going to do $2,600 is going to be your hospital delivery, and that's times 1 because you're only doing 1 delivery. So $2,600. Oh. And then how much does prenatal doctor visits cost? We'll look at that. How much does is it postnatal or prenatal? Let's look. Oh, prenatal and postnatal. So how much does a prenatal visit cost? And that's going to be around, the total cost of prenatal care is going to be $2,000. And that includes 12 doctor's visits at $100 to $200 each. Okay. And so we're just going to do $2,000 for each of those. So prenatal and postnatal, let's go $4,000. Now, remember, and that's going to be total. If you have insurance, that's going to cover a lot of it. So when you see that number, don't freak out and be like, oh my gosh, I can never afford to have a baby. That's $4,000 just to get checked out. You're going to have insurance most likely. And that's going to cover a lot of the cost. But I'm not going to go into insurance because it gets too complicated. So you're just going to put the total cost there. Because that one is pretty high, your $4,000, you may see higher than $7,000 at the end. Because if you look right here, I'm already at $4,000 plus 2 is $6,600. So that's going to be a lot more. My total is going to be way more than $7,000. So that was, what was it again? Sorry. 6,600. Okay. And then I'm going to go and do my baby clothes and so on and so forth. So, you just go to Amazon and you need whatever you need. So 0 to 3 month onesies, you need 5. So if you can find a pack of 5, that's probably going to be your best option. If you find a pack of 4, you can buy just 2 of those packs. If you find a pack of 6, just buy 1 of those packs. It doesn't necessarily have to be 5. It means you need at least 5. Does that make sense? So at least 5. So if you have a pack of 10, that's totally fine. You can use that. If you find a pack of 3, buy 2 packs. Okay. And then you're going to write your total cost, just like how we did up here and I showed you. And then you do your baby clothing subtotal. Then you go into your sleeping needs, baby sleeping needs subtotal, diapering needs subtotal. And like you can see right here, this is telling you that you can go to diapers.com. Honestly, I took this assignment from another teacher, which is why I don't do that. I'm going to do everything on Amazon. It's way easier. And with Prime, it gets there in 2 days. So Prime is going to be your best option. So I choose, also Toys R Us is not even a thing anymore. So this assignment is old. Toys R Us shut down forever ago. So you can go through and just do Amazon on all of those things, okay? And then your additional items, and then make sure you look at the number needed, and then you do your total. Then your subtotal, put all these here. Do your total cost of raising a baby, do your total. Go ahead and save that bad boy, okay? And then after you save it, you are going to submit it into Canvas, where I open the assignment for the cost of having a baby worksheet. If you have any questions, please shoot me an email, and I will be happy to help you. I love you all, and I miss you terribly.